Okay, here we go. Oh, I can tell already this is going to suck so bad. Oh.
I don't think I put enough on.
No. Okay.
Oh, something hit there.
Yeah.
It's like in the back of my throat.
It's in the back of the throat. That's way back there.
It skipped the tongue, went to the throat. This one's making me sweat.
Welcome, everyone, to Spice It Up. I'm Michael Elliott with Valley Health Foundation. Happy Giving Tuesday. We're so excited today to bring you some of our favorite people that we get to work with on a day where we're hoping to raise $30,000 to support essential healthcare services. I'm with now the person that was available to us. Unfortunately, the guest we wanted wasn't here, so we have our backup guest, Dr. Praveen Anchala, head of radiology at Santa Clara Valley Healthcare. Praveen, welcome to Spice It Up.
Thanks for inviting me second.
So the goal of this show is we're going to learn a little about you, a little about your work, and we're going to eat some very, very spicy food. How is your just spice tolerance in general?
I would say it's pretty freakishly high.
Freakishly high?
Yeah.
What's your go-to?
I don't want to overstate it, but it's pretty
You're going to be our most spice-friendly guest today.
I'm one of those people where people say, do you want pizza with your red pepper?
Very, very good. Well, our first spice today is going to be from Senor Lechuga hot sauce. This is a lemon garlic habanero. Let's pour a little of this on here. Habanero sauce, I think, is going to be kind of low to medium.
Yeah, this will be child's play for me.
What is your go-to spice or sauce that you go to?
Well, mostly for real dishes, usually like a sambal. It's not too spicy, but it's got a good flavor.
In the South Asian category of food.
Category.
Okay, so let's talk about you. You are a radiologist. For folks that don't know, what does a radiologist do?
It's a good question.
I hope you know the answer.
Yeah. Radiologist does a lot of different things, Michael. Radiology is at the intersection of technology and healthcare. So we use cutting-edge technology to help diagnose and treat patients of a variety of different illnesses, both in the outpatient setting and acute care settings like inpatient hospital and the ED. So we're sort of all over the place. Since COVID, the amount of volume and radiology studies has increased significantly. And it's just an awesome time to be a radiologist.
This is like X-ray, MRI, CT, that kind of stuff.
X-ray, MRI, CT, ultrasound, minimally invasive procedures.
You and your colleagues, I've seen them, are in these things called reading rooms with these incredible monitors. And you look at image after image after image. And that, to me, seems like that would be very challenging mentally. How do you actually do that work of just all day looking at the insides of other people in these sort of radiological settings?
Yeah, I mean, it can be mentally taxing. There's a lot of decisions. There's, I think they've done studies of tens to hundreds of thousands of decisions per scan. If you do like a CT scan, so there's a lot of information you're taking in, and really what it comes down to is just your training. It comes down to just like anything else. The more you've seen, the more your brain sort of picks up and analyzes and recognizes issues and sort of brings them up to your attention for you to sort of make the diagnosis. And everyone has a search pattern, so you try and follow the same pattern every time so that it's more of a ritual and less of like a gestalt.
Let's try the food here. Let's try this sauce here. Let's see what we got.
So this is the habanero, and I got a nice tofu spring roll here.
Mm-hmm.
Thank you for minding the vegetarianism.
Very good. This is my level of heat.
Yeah.
This is unfortunate for me because this is about the hottest I want to go. And we're on sauce one. This is for you easy.
How many sauces do we have?
We have 3 sauces.
Okay.
Yeah. So this is about as hot as I want to go. This is fine for you.
This one's fine for
You're doing your stroke out. You went to a prestigious medical school and got incredible training, and you come to and I don't.
Oh well, thank you.
Yes, you did. And I don't even know I can't remember what medical school, but I'm sure it was a prestigious one.
Yeah.
Knowing you,
I have no idea what you did.
You choose to work here at a county public hospital. You could work anywhere. And this part I am being serious. You could work at any hospital system in America if you wanted to. But you choose to serve your county system. Tell me why that's important to you.
I grew up as a child of 2 immigrant doctors. So they came here with very little. I think $7 they landed in the country and sort of tried to scrap and fight their way while taking care of patients to be able to provide a living for their kids and their family. And because of that, back then there was a lot of racism in the 70s. So physicians coming from other countries, they weren't able to go to big cities like San Francisco, Chicago, whatever. So we were in rural southern Missouri for a lot of our life growing up. Because of that, as we were growing up, medicine to me wasn't really a calling yet. It was I went into I did my major in economics. I sort of had a background in finance. And then as I was doing that, I sort of became a little bit disenchanted with that sort of work and realized, oh, there is a purpose. There was a reason that, my parents were doctors, and I kind of came back to that as well. And even then, even as an early physician, so much of it was like still very, very focused on the individual, because that's how, coming from immigrants, that's how you're kind of raised. Like your family and your unit is kind of like what you're trying to bring up, right?
Right.
And they did that in a way of taking care of other people, but the center of attention was still always making sure that your family was taken care of, right? And it wasn't really until I started working at the county at the same time, a few years later, COVID happened. And during COVID, we had our first kid. We actually had both kids like within 2 years.
You and your wife?
My wife.
Yeah.
During that early part of COVID. And from there, my attention really sort of changed because it became, medicine was a way of life. Medicine was like a calling and all that. But really what it became was medicine switched into a purpose, because once you have kids, you realize that you can't live in a vacuum. Everything that your kids are engaging with out in the world, you send them to school, they're walking down the streets, they're on bikes, like those are all different people, and you have to be able to take care of them all. And you want them to have good interactions with your kids, and you want your kids to have good interactions with them. And through that became a little bit more of a service mindset or a service purpose of like, there is more to the community, there's more to what we live in than just our family unit. And so it was even as I was going through it, I was kind of recognizing like this is a big change for me, because it wasn't usually how I thought before. Like administrative jobs and sort of leadership positions, it was never really something that really caught my attention. It was very much like I don't understand the point of that. It seems like how do you use your time? Like it seems like I could use my time in a better way. And then I sort of realized as we were during those same times, like these sorts of positions, now medical director of radiology for the county, and chair of radiology, is a way for me to use my ability and knowledge and skill set to sort of leverage that to take care of a larger breadth of people and really sort of move from an individual mindset to a population-based mindset. On
that note, let's go to the next one, though.
By the way, that was the long answer.
That was the long, but the pandemic was a awakening for you in how you thought about this work as a physician, as you're not just a doctor seeing patients, but you have a responsibility for the entire community.
The pandemic definitely showed the importance of community, right? We went from people didn't realize if we were home or not to like walking around and like understanding like who your neighbors were and meeting your neighbors and understanding that like the people around you play a significant part of your life. I think that combined with the same thing with kids, like, you want to have a good relationship with your neighbors because they're going to be driving around your neighborhood. You want them to slow down when they pass your house, all that kind of stuff. It really sort of makes you part of the community. And I think as you go through that, you sort of realize that the jobs we have can affect all of those people. And I started taking it more seriously.
Okay, let's go on. Now it's Elotes Loco from Austin, Texas. We're going from 1,200 Scoville units to 60,000 Scoville units. You're a smart guy that worked in finance. What's that percent increase in Scoville units? Calculate it for us right now.
A lot.
Go. Yeah, that's yeah. Obviously, you sound like a guy. You sound like a guy that used to work in finance.
50x.
Okay, let's try this, and then we're going to talk. I want to talk about this project that you and I just did together. But first, let's first destroy ourselves.
How much are you putting on? Whoa, hold on. I want to see how much you're putting on.
That's a decent amount.
That's a decent amount. Because I mean, this is important. Because I don't want just a little dab, and then
No, I'm gonna do. We're playing for real today.
We're playing.
Yeah. Okay.
Not bad. It's like hummus.
It might still be coming. It's pretty good.
You waiting for the after effect?
Yeah, I'm waiting for the after effect, but it's not. I don't think it's coming. Now this might be the great mistake. Well, I'm just gonna get more.
Oh, that means I have to do that too. I don't want to.
That was really good. Okay, that's a good sign of the last one to come. So
this is like a promotional video for Elotes Loco Fire Edition. Please donate to Valley Health Foundation.
Hey, they're really good at this. So let's talk about the situation that we were just ourselves in. The federal government in July announces the largest cuts ever in the history of the country to reduction in spending for healthcare programs, particularly Medicaid. It's $1 billion cut for us. In about 3 weeks, we decided we're going to do something about it. We put Measure A on the ballot. And you and I worked super closely on that together. And on Tuesday, we won, which was insane. Talk about that experience of having to be out in the community and talking to voters, reminding them the importance about, I have, I'm a Kaiser user, or I live in I usually go to El Camino. I don't, like, why do I care about our public hospitals? What's the kind of lessons you learned in terms of like how you engage with voters and got folks to be committed to saving these hospitals?
Honestly, I myself have learned a lot about our system as we've gone through this. I'm sure everyone has. You sort of learn, the county is one of those systems, the healthcare system, but also just the county in general, where it's so much of our population is reliant on so many things that you just don't realize. And something like HR1 that takes away that much money has a deep impact on so much that we do. And I think as I've learned about the county and everything that money goes to, you start to realize like, wow, like it's more than just a regular hospital. We take care of patients that have no other choice. But we also take care of patients who do have a choice, and we're just really good at some things, and they want to come here and they need to come here for very specific reasons. But most importantly, if a hospital closes, it has a chain reaction to all the other hospitals in the area. So there's no shielding from that. It doesn't matter how much money is in your wallet. It doesn't matter what insurance you have. If the wrong thing happens to you in wherever in the city, you may be brought to somewhere and you don't have a choice about it. And that's sort of the reality. And when that happens to you or your family or your neighbor, you want that to be somewhere that you care about and that is going to treat you well. And that's what I tell my department all the time. Our job in healthcare is to make sure that the care that we provide to patients is the same care that we would want us to have, your partner, your kids, your parents, and your neighbors to all have. And that's really what it's about in the end, providing for a community.
Praveen, we're moving, and this is a special one from me to you. This is the Queen Majesty Sicilian Scorpion hot sauce. I'm half Sicilian.
Oh, well, there you go.
So you can tell by looking at me.
Absolutely.
So this is, and this one we were at 1,200, 60,000. This is 250,000.
Okay, we're ready.
I'm laughing, but
That's four
terrified.
times as much.
I'm terrified. Thank you for the quick calculation. So let's do this, and I might not make it through this. So just keep talking is the most important thing.
Yeah,
that's for you. So here's my question to you. You not only just oversee radiology across 4 hospitals and 15 health centers, but at 2 hospitals that have trauma centers. So tell me what it's actually like. And you've worked those cases when a trauma comes in, when a family that comes in injured in a car accident, you got to get imaging really quickly. And I imagine that's a very intense moment for you and your colleagues, because you got to make some decisions and get some data back to the rest to the surgeons really quickly. Just walk us through, what is that like when a big trauma case comes in?
Yeah, well, when a really key trauma, like a level 1 trauma, the worst type of trauma comes in.
Oh, speaking of trauma, let's traumatize ourselves, and then let's talk about trauma.
I can smell the pepper on that one. It hasn't hit yet.
No.
I can feel
It's coming.
I can feel the temperature.
Oh, okay. So tell us.
What's that? I'm taking a bite.
Yeah, I will too. Let's get into this, because this is an important question that I think people really need to know.
This one's definitely hotter, but
Yeah.
I think I'm still okay.
I'm not going to be okay, but
No.
that's why I'm here with you.
Okay,
To
good.
talk about the trauma cases.
Yeah. Well, I think first, radiology is always a team specialty. So it's not just the radiologist; it's the technologists, it's managers, everyone along the way to be able to get the images from the patient all the way to the doctor for us to be able to look at it. So our worst cases, the level 1 trauma cases, where patients are really at critical risk. We stop everything that's happening, any other study we're looking at in real time, try and look at those cases as quickly as we can. Oftentimes the surgeon's either in the room or calling, because they're also wanting to know very quickly what they can do so that they can, know whether this patient's gonna be okay or whether they need to immediately, take the patient to the OR or do some other stabilization method. And so it can be an intense environment. And the tricky part is, sometimes when your network infrastructure goes down or there's other problems, that doesn't stop the need for what the patient has. You have to go to the scanner, you have to read it on the scanner, and you have to be comfortable and flexible and be able to think quickly to be able to get those diagnoses to where they need to go, because it could be a patient's life on the line.
I haven't listened to really anything you've said. I'm just suffering right now. Right now. It's just, I don't like this one as much.
Yeah. Well, this one, the flavor's not as good.
I don't understand the point of this.
This one, I definitely can feel the burn on this one.
I can feel that too.
Yeah.
I'm gonna have some.
There's a little bit of sweat coming on this one.
Is there? Yeah. Okay. But this for you is no big deal.
I mean, I wouldn't enjoy eating this, but
No.
it's not like I'm not afraid for myself.
Yeah.
You know, there are some peppers where if you get a little seed in your throat, it can burn a hole in yourself.
Seriously, have you seen those in a radiological survey?
I have not.
You have not. Okay.
But I've read about them. I think Carolina Reaper, I think, is the one.
That's the one?
Yeah.
Okay, we're going to add a fourth one because Praveen here is just, we're not breaking you. I'm broken, but you're not broken. And the viewers need
Yeah,
to
we
see
want a
you.
real challenge here.
So this is the Bomb Evolution hot sauce. It's got a little nuclear bomb on there. So this is only 135,000. It's a little less Scoville than the last hot sauce, but we know it's not just all Scoville. They actually describe this product. They describe it as brutal. So
Yeah,
that's terrific.
We've been told that this is the one to do.
This is the one that is going to take Praveen
And by the way, this is not a sauce. This is like a paste.
It is like a
jelly.
paste, and you may leave medicine after this.
I'm nervous just now even putting it on here.
Okay, so I want to ask, in radiology, you really see the insides of people, and when you see the insides of people, you can learn a lot about their lives. Interesting things you've seen on images that you wouldn't normally find.
It is interesting because a lot of the times we're seeing x-rays and images of people, and we're not actually seeing the person a lot of the times. And in some cases, you can really learn a lot about people. Like once on Valentine's Day, we had a husband who was upset with his wife, took her rings and ate them. We had an X-ray and a CT of just the rings in someone's throat.
Yeah, that's
the ultimate punishment.
Yeah. How much time did you spend diagnosing it as a ring? Did you say that's
the ring was easy.
Yeah.
Radiologists tend to be a little bit nerdy sometimes, and so the goal became to determine whether it was a real diamond or not. And there's a lot of data out there about what the density of a diamond is compared to cubic zirconia.
Oh,
so
you could have potentially also conveyed if it was a fake diamond. That would have added a whole other element. You put that in the chart,
right.
Ring with fake diamond. The patient would have seen that, and that could have added a whole other
Correct. And
story.
we went and found the wife, told her it was a CZ, and then the guy was even in more trouble.
So helpful. So helpful. Okay, let's now ruin our lives. We're on a quest together. The good thing is that Praveen and I are used to doing, after having just one Measure A, we're used to doing painful things together.
Yeah, a lot of our conversations are painful.
Okay, here we go. Oh, I can tell already this is going to suck so bad. Oh. Shit.
I don't think I put enough on.
No. Okay.
Oh, something hit there.
Yeah.
It's like in the back of my throat.
It's in the back of the throat. That's way back there.
It skipped the tongue, went to the throat.
It is way back there. I'm going to have to go to our non-alcoholic 0% beer on this one, guys.
Yeah. This one's making me sweat.
Okay, so, Praveen, tell me.
It's got a chemical taste to it.
It does. It's not good. I don't understand people that use this.
This doesn't have flavor.
It doesn't have anything. I don't understand the appeal to this. I think this hot sauce only exists for hot sauce eating shows. Where
That
you
being
have to
said,
use hot sauce. Oh.
Spice in foods that makes the Bomb Evolution, please donate to Valley Health Foundation.
Yeah, thank you. All right, well, perfect transition. So this is, you and I are sitting here to help raise money for Valley Health Foundation. Obviously.
Obviously.
Yeah.
Is that what we're doing here?
That's the goal. Praveen, as someone who works here, who serves this community, tell our viewers, our many viewers, why giving to Valley Health Foundation this Giving Tuesday is something that they should do.
Yeah, well, Valley Health Foundation is a critical component of what we do at Santa Clara Valley Healthcare because it allows us to take care of patients in a way that sometimes we can't do with taxpayer funds and taxpayer money. It gives us another avenue to really address challenging things that physicians and nurses and people in the hospitals are seeing, and it helps the community give an avenue to help support us. And I think as we've seen with Measure A, that support is important because we don't always know how many people out there understand what the importance of this type of work is. And Measure A and donating to Valley Health Foundation is a critical way for us to be able to get a sense of it.
That's great. That's great. You did really good. Again, I wasn't really listening because I'm still focused on.
I got some sweat on
my mouth. Is on mouth on fire. Well, thank you, Praveen, for joining us today. I think we've learned a little about you and about each other, and about these hot sauces. Some of which are fine, and some of which are terrible, frankly. But thank you for being here, and in all honesty, thank you for the work that you do. You are an incredible servant to this institution, and you're an inspiration to myself and so many others. And we wouldn't have won Measure A without you. So thank you. And now go back and take care of patients because that's what you're paid to do.
Yes. Thank you. Appreciate it. And that's what we'll do.
Thanks, Praveen.